Hello, I'm Dr. Shukla. I'm a practicing and teaching dermatologist. Today I'll talk about treatment of rosacea. I'll also tell you how to prevent it. The treatment of rosacea is focused on two main issues. One, the frequent redness on the face, and second, the treatment of acne-like bumps on the red areas. To treat rosacea, we have many modalities like medications, laser, and surgery. Which one is best for you? It's to be decided by your dermatologist. For redness on cheek, nose, chin, and forehead, your dermatologist may prescribe oxymetazoline or brimonidine creams or the gels. One important thing is to remember that redness worsens with the sun exposure. So you have to avoid sun exposure as far as possible. To control the bumps or pimples in rosacea, we use azelaic acid, metronidazole, and ivermectin as creams or gels. With these medications, improvement may take about 2 to 6 weeks. If you have a severe disease and it's not responding to the creams and gels which I just mentioned, then you may require oral medications also in addition to the creams and gels. In oral medications, we use antibiotics like doxycycline, and if it's not responding to doxycycline alone, in that case, we may use isotretinoin also in place of doxycycline. If these medications are not useful, then we have an option of laser therapy. In laser therapy, we block off the tiny blood vessels because redness in rosacea is due to these tiny blood vessels. So either we block them off or we just remove them. Dermabrasion is also good for rosacea. Here we use some rollers to peel off the superficial skin. Sometimes in rosacea, the skin of the nose gets thickened, and if it is not acceptable cosmetically, then we have the option of surgery. Treatment of rosacea is a long-term treatment, so don't get discouraged if it's not giving a quick response. If you want to conceal the redness of rosacea, you can use green tinted moisturizers. Now, prevention of flares-up is equally important. So what are those measures by which we can prevent the flare-up? The most important of it is avoiding sun exposure as far as possible. To avoid the sun exposure, we can use non-comedogenic broad-spectrum sunscreen. Another care which you have to take in rosacea is cleaning your face at least twice a day with gentle cleansers. Any product containing alcohol or menthol should be avoided in rosacea. It is also important to avoid extreme temperatures, extreme cold or extreme heat. If you notice that certain foods aggravate your rosacea, in that case, you have to avoid those foods or cut them to some extent. The foods that usually can worsen the rosacea are spicy foods, red chilies, chocolates, tomatoes, and cinnamon, and drinks like hot tea, coffee, and red wine. You should also avoid using steroid creams over the rosacea because that can worsen the disease. So this is all for today. See you soon with the next new topic. Thank you very much for watching the video.